So, Tia Reid, you come out very early in your book. You talk about a pretty startling statistic. 20,000 Americans die each year because they can't afford to see a doctor. And, when I looked at the statistic, I had to go and reread your bio because I had to think, now, is this, some left-wing nut? But no, I should mention that Tia Reid is a longtime correspondent for the Washington Post and has worked in Japan and Britain and so has firsthand experience. But I'm still surprised that this 20,000 people dying because they can't get health care is something that has been so little discussed in this debate about health care reform. Instead, we're sort of hearing, made-up terms like death panels.
I could kiss you because this is exactly what I say on the first page of my book. We meet a 32-year-old American college graduate who died of a treatable disease because she lost her job and couldn't get health insurance. No other country lets that happen. You know how many people in Britain die because they can't see a doctor? 0. France, 0. Germany, 0. Japan, 0. We shouldn't let this happen. We're the richest country in the world. We could treat everybody if we would decide to do it. And I think one reason we haven't made the commitment to treat everybody is because people feel like you do. It can't be true. Of course we take care of everybody. We don't.
Well, I don't know that I feel it can't be true. I just feel that I'm surprised that it isn't more a part of the discussion and that it's something that, for example, we haven't heard the president say in this discussion about health care reform.
I'm looking for that, too, because, the reason I did the book is I was trying to figure out all the other developed democracies cover everybody with high quality and spend half as much as we do. How do they do that? That's what I set out to find out. But it turns out the more important question was, why do they do it? Why does a country commit to give everybody health care who needs it? And if you think about that for about 2 minutes, it leads to the next question, why doesn't the richest country in the world provide health care for everybody? I think I answered the how. I think I answered why the other countries do it. I'm still struggling with why our country has never made that commitment.
One of the things that you're talking about in your book is that even with all the money that is spent in the United States on health care, the United States doesn't get the best outcomes. Now, is that because so many people don't have access to medical care, or is it because the actual procedures are not producing good outcomes for people?
Yeah, a terrific question. The answer to that is the reason we rate lower than other developed countries on medical outcomes is because so many people don't get care. If you have insurance and you get to a doctor or hospital in America, you get world-class care. That's why Arab sheiks fly to the Mayo Clinic to get treated. We have great medicine. We just haven't made it available to everybody, and that's the fundamental distinction with the other rich countries. They have a basic floor of coverage that everybody gets, and we don't do that.
In your book, you cite a poll that says upwards of 70% of Americans want some kind of health insurance reform. And certainly last year when I was out covering the political campaigns, it was something that Republicans, Democrats, everybody was talking about. And yet this debate seems to have come to the point where a lot of people are stepping back and saying, well, maybe the devil I know is the best option. Why do you think that is?
Well, for one thing, it's a $2.4 trillion industry. There are 1,000 companies making more than $1 billion a year on healthcare. There are a lot of winners in the current system, so they're going to fight change. I'm disappointed, frankly, in the way this debate has turned into, well, my insurance is okay, so leave me alone. It's not really the issue. The issue is for our whole country, the system isn't working. Even if you have good insurance today, you may not tomorrow because the insurance companies cancel like crazy. But even if you do, your neighbors are going bankrupt. Your neighbors are sending their kid to bed with an asthma attack because they can't afford a doctor. I have good insurance. I'd still like us to see us provide insurance for everybody else.
Does it surprise you that that doesn't sort of seem to be the natural consensus? I mean, after all, Americans are very generous people, and they give to each other in all kinds of ways and believe in supporting each other in all kinds of ways, and yet it seems to stop when it comes to health care. Then all of a sudden we're talking about socialism, communism, and all those other things that Americans are very resistant to.
Yeah, I agree with that. So why is that? Well, in my book, I finally conclude we are generous, caring people. I don't think Americans know how bad it is. If you take a poll, for example, here's a poll question. Do you think anybody in your community who's sick can see a doctor quickly? 96% of Americans say yes to that, but it's not true. Millions of people can't get access.
One of the really very compelling parts of your book is when you talk about the cultural assumptions that underlie care. And for example, you talk about your shoulder industry, which, this seems as good a time as anybody to say, why do you have this injured shoulder?
Yeah.
And then, talk to us a little bit about the way sort of different countries assume it should be treated.
Well, I bashed my right shoulder when I was in the U.S. Navy. This is a long time ago. And they repaired it at Bethesda Naval Hospital. At the time, it was a great repair. Nobody would do it today. I've got a big stainless steel screw holding my shoulder together. And it hurts. It's a long time ago. It's not working. So I set out to do this book, really trying to figure out how come all the other countries managed to cover everybody. But I figured, hey, I'm going to be going to great doctors all over the world. I'll take my shoulder along with me and see if I can get it fixed. And
it'd be kind of hard not to take your shoulder along with you.
Yeah, exactly. So what I did was, I go in as a reporter. I kind of look at policy, but I also go in as a patient. I go to every healthcare system and walk in the doctor's office and say, look at this shoulder. What are you going to do? Some countries were perfectly willing to do anything. In Japan, he would have put in an artificial shoulder, gave me acupuncture. He would have given me Western medicine, Chinese medicine, Indian medicine, all covered by Japanese insurance. In Britain, we lived in Britain, and the NHS the National Health Service was good for our family, and it's totally free. You never even got a doctor bill, nothing. But that doctor didn't want to do anything. He said, you're living your life. You're doing okay. Go home. Live with it. Stop whinging.
That's essentially what the French doctor said too. I mean, he said physical therapy. He said, you can deal with this.
Yeah, he would have given me the operation if I'd wanted it. It would have cost 5,000 euros, $6,500, which is about a fifth of what it would cost in America. But he recommended against it. Yeah, do physical therapy. I'll give you some pain pills. In Germany, same thing. They would have done the operation. They do it there. But that doctor there thought physical therapy was the approach. In Canada, this won't surprise anybody, it's the only country I never even saw an orthopedic surgeon. I went to a doctor. They have a gateway system. You got to go to the GP first. Doc, look, my shoulder barely moves. Yeah, you better go see a specialist. I'll write a recommendation. How long will it take, doctor? 10 or 12 months. 12 months to get in the office, not to get... So Canada, I got nothing.
Would it have been different if you'd been in a more acute situation? I mean, this is an injury that you've obviously could travel around the world, trying to look for solutions. Yeah. Would it have been different in Canada if you'd had sort of a hole in your shoulder or something?
Yeah, if you have an acute problem in Canada, they treat you and they treat you free. You get sick in Canada, the ambulance comes to your house free. You go to the hospital for free, and 2 weeks later you go visit your doctor. This is all free. So if you're acutely ill in Canada, rich or poor, young or old, they take care of you. But if it can wait, if your hip hurts or your shoulder hurts, you wait.